السلام عليكم ورحمة الله ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومتريك Review of PROMETRIC Test Question. This is lecture number 3 in Maternity and Child Health Nursing and number 42 in Ghaith Review. Today we are going to discuss 5 questions from question number 227 up to question number 231. معكم محمد عثمان يحيى. نبدأ مباشرة. Question number 227. A nurse is assessing the uterus of a gravida 5 para 4 patient immediately after delivery. The nurse notes the fundus is not contracted. Which of the following is the most appropriate immediate action should be taken? The options are number A. Massage the fundus. Number B. Assess the bladder. Number C. Elevate the mother's legs. Number D. Encourage the mother to void. وقف الفيديو هنا واختار الخيار اللي تشوف صحيح. The correct option is option number A. Massage the fundus. ليه اخترنا الخيار رقم A؟ نشوف rational. If the uterus is not contracted firmly, the first intervention is to massage the fundus until it is firm and to express clots that may have accumulated in the uterus. So the correct option is option number A, massage the fundus. Elevating the client's legs and encouraging the client to void will not assist in managing uterine atony. And if the uterus does not remain contracted after the uterine massage, the problem may be distended bladder, and the nurse should assist the mother to urinate, but this will not be the initial action. Question number 228. A nurse is assisting during a normal vaginal delivery on a 22-year diabetic patient. The head was delivered without any complication. Head suddenly retracts against the perineum, prompting the physician to immediately ask for the nurse assistant with this dystocia. Which of the following will be the nurse's appropriate action to impact the shoulder of the infant? The options are number A. Fracture the infant's clavicle. Number B. Prepare patient for immediate cesarean section. Number C. Apply fundal pressure to displace anterior shoulder. Number D. Perform suprapubic pressure to release anterior shoulder. وقف الفيديو هنا واختار الخيار اللي تشوف الصحيح. The correct option is option number D. Perform suprapubic pressure to release anterior shoulder. اللي اخترنا الخيار رقم 2 نشوف rational. From the scenario, the mother experiencing shoulder dystocia. Shoulder dystocia is a condition that happens when one or both of the baby's shoulders get stuck during vaginal delivery. There are 4 maneuvers generally used to resolve shoulder dystocia. They are number 1, McRoberts maneuver and suprapubic pressure and Wood's screw maneuver and delivery of the posterior arm. So the correct option is option number D. Perform suprapubic pressure to release anterior shoulder. Suprapubic pressure, as you see here in this picture, in this maneuver, the labor nurse places direct pressure with an open hand or fist just above the mother's cervix pubis. The pressure can be directed straight down or to the left or right. Wherever it is directed, the aim of the pressure is to push the baby's anterior shoulder out of its position behind the mother cervix's pelvis. Question number 229. At labor room, a nurse assesses the condition of the patient and gathers the following data. Cervical dilatation from 4 to 7 centimeters. Contraction every 3 to 5 minutes, lasting 40 to 60 seconds. Increasing bloody show, leg discomfort with heaviness. What is the significance of the data? The options are number A, patient on the first stage of labor. Number B, patient on the third stage of labor. Number C, patient on the second stage of labor. Number D, patient is experience a prolonged labor. وقف الفيديو هنا واختار الخيار شوف صحيح. The correct option is option number A, patient on the first stage of labor. ليه اخترنا الخيار رقم A؟ نشوف rational. This data indicate that patient is on the first stage of labor, specifically active phase. In the active phase, the cervical dilatation occurs more rapidly, increasing from 4 to 7 centimeters. Uterine contraction grows stronger, lasting 40 to 60 seconds, and occur approximately every 3 to 5 minutes. So the correct option is option number A, patient on the first stage of labor. Question number 230. A primigravida mother is having her baby through normal vaginal delivery. The baby is completely delivered, but the mother is still experiencing the uterine contraction. What stage of labor should the nurse identify? The options are number A, beginning of the third stage of labor. Number C, indication of increase in vaginal bleeding. Number C, need for reducing the rate of intravenous oxytocin. Number D, uterine contraction will gradually reduce then stop. وقف الفيديو هنا واختار الخيار بالشيء الصحيح. The correct option is option number A, beginning of the third stage of labor. ليه اخترنا الخيار رقم A؟ نشوف rational. The correct option is option number A, third stage of labor. The third stage of labor starts immediately after the delivery of the infant and ends with the delivery of the placenta and membrane. It usually lasts less than 30 minutes and mostly 2 to 5 minutes. The uterine contraction continues, although less frequently than in the second stage of labor. So the correct option is option number A, beginning of the third stage of labor. Question number 231. A mother in the outpatient clinic for her first postnatal visit on the 15th days her normal vaginal delivery. Her physical examination reveals a stable condition. Breasts are soft and her sanitary napkin has bright colored rubber. Which of the following needs further evaluation? The options are number A, amount and frequency of breastfeeding. Number B, hydration level and bleeding breastfeeding. Number C, activity, exercise and resting period. Number D, uterine size and position. وقف الفيديو هنا واختار الخيار شو صحيح. The correct option is option number D, uterine size and position. ليه اخترنا الخيار رقم D؟ نشوف rational. There are 3 different stages of lochia following birth. Lochia rubra occur on day 2 to 5 post-birth and blood will be red and heavy with some clots. And lochia cirrha occur on day 4 post-birth and blood will be light watery pink. And lochia alba occur on around week 2 post-birth and the color will be yellow white. At the 15 days after normal vaginal delivery, the lochia color should be yellow or yellow to white. It is called lochia alba. Therefore, if the color of the lochia until the 15th day post-birth is red, the uterine need further evaluation. So the correct option is option number D, uterine size and position. شكرا جزيلا، نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.